So liver transplantation is a surgical procedure where a patient with liver failure receives a new liver and gets a new life. In living donor liver transplantation, that new liver is donated by one of his or her family members. Usually a part of the liver from a healthy family member is taken and transplanted into the patient. This is called as living donor liver transplantation. Living donor liver transplantation involves a healthy person, a family member, donating a part of his or her liver to the patient. To make sure that the operation is successful and the operation is safe for both the donor and the recipient, a lot of tests are done for the donor to assess his or her fitness. These include tests to assess his general fitness, tests to assess the quality of his liver, tests to assess the size of his liver, so that the operation, when it is done, is absolutely safe for the donor and the donor can make a completely smooth recovery and have a completely normal life after the operation. In terms of criteria, every center has slight variations of a common theme. The youngest age for donation is 18 years because that's the legal age for consent in our country. The older age in our unit is 50 to 55 years, whereas in centers in Korea and Japan, even donors up to 60 years have donated. The donor should be completely fit, which means he or she should not have any heart disease, any long-standing diabetes, or any other medical problems that can increase the risk of any surgery. The detailed evaluation that we perform includes blood tests, scans, heart evaluation, and the donor is also seen by multiple specialties to make sure that every aspect of the donor's health is absolutely fine so that the operation can be conducted completely safely for the donor. So, donor surgery for living donor liver transplantation is a major operation, and hence every possible precaution that can be taken both before surgery, during surgery and after surgery are taken to ensure a rapid recovery and well-being of the donor. The surgical techniques that are used are cutting edge to ensure that the operation goes safely for the donor. Usually after surgery, the donors are managed in the ICU for 2 to 3 days and then shifted to the ward. Usually by the end of the first week, they are ready to go home, and by the time they are completely well and completely independent. We then follow these donors up for the first 1 month with regular blood tests and scans to ensure that the liver is recovering well and the liver is growing back to its normal size. In fact, our studies show that at the end of 1 month, the liver has grown back to the size it was before the operation. That is the remarkable ability of the liver to regenerate. In the long term, the donors get back to their normal life. They can do everything and anything that they were doing before the operation. There are no dietary restrictions, no travel restrictions, no restrictions in terms of family, and they can have a completely normal life. I think the first message I would give is that in experienced centers, living donation is safe. And it is the best way and probably the quickest way for your loved one to get a liver transplantation in our country. Donor safety is of paramount importance for any experienced center doing living donor liver transplantations. The donors undergo a lot of investigations and evaluations to make sure that the operation is completely safe for the donor.